Karibuni katika filamu inayotengenezwa kuhusu Muheza Hospice Care.
Muheza district lies just south of the equator in the Tanga region of Tanzania, where rural communities are linked by rutted, rust-coloured mud roads. In 2001, Doctors Richard and Karilyn Colloins moved to this colourful and vibrant corner of Africa. Richard took on the role of medical superintendent and physician at Muheza Hospital, with AIDS and untreated cancer having devastating consequences within local communities. Karilyn saw an urgent need for palliative care. With support from the Diana Princess of Wales Memorial Fund and donations from friends, Karilyn founded Muheza Hospice Care. After training some of Tanzania's first palliative care professionals, the hospice has gone on to build a reputation for providing high quality care and treating patients and their families with dignity. Day hospice is one of the services providing people with physical, social, emotional and spiritual support.
First of all, most of these patients are the patients with chronic disease, particularly cancer. Most of them have severe pain, severe psychological problems, and social problems. So when they come here, we as a palliative care team, we assess physically, psychologically, and socially, and make sure we manage according to the problems. Those with severe pain, we give them morphine. Those with psychological pain, we counsel them. And sometimes we visit their homes and do family counseling to make sure we decrease the complexity problems which they have, especially in psychology. The palliative care service in our country is very limited in government hospital, so we are helping a lot. If we close, they are going to get a lot of problems, and I'm sure according to our area, there will be another place for them to access this service if they are getting here.
Jess is a new patient, and I saw her on the day hospice. She has a complaint of lower backache with unable to walk. While she at home, she started to experience the pain on the lower limbs and the lower backache. And what I received from her after investigate her, after doing the physical examination, I just found that maybe she has a metastasis to the lumbar spine. So she started to go to spinal cord compression. So I prescribed the medication. I just tell her to continue with the oral morphine. So with the dose of 5 mils, for her it's okay. When she takes the 5 mils, the pain is going away. So I just add the prednisone tablets and the oral morphine, and then I add the brufen tablets for the back pain. Most of the patients with the cancer, they become free from pain because of the medication which are prescribed at the Muheza Hospice, and now they are able to do their own work at home. They are able to go to the farm. Most of them, they are able to go to do some small businesses and so on.
We are at a village called Misongeni. It is found in Muheza district. We came here to visit one of our patients called Mwana Hamisi. She is our patient for about 10 years, getting palliative care service in our center. Usually she comes for a hospice day clinic, and we sometimes visit with doctors and nurses for her care. Since the grandmother is blind, we have a talk asking her what problems they face. So we have got full explanation from her grandmother. She's complaining about having not food to feed the families because she lives with Mwana Hamisi and 2 grandchildren. And when we reach here, we also look the whole family, especially her grandmother, who is very old and sometimes is sick. Like today, after assessment, she's seen with the problems and given antibiotics and other medicine for her health.
Today we came to Magila village to see Rosingano. It's her first visit, and last week she came to the hospice care and we decided to do some checkup on her. When we saw her, she was doing well, she's active, and the pain has relieved, not like it was before. We discovered some new things, that she's doing better, and the morphine was almost off, so we provided her with more morphine and some more painkillers to cut off the pain. It's important to come to people's home because we get to know if they're following the instructions we give them at the hospice care, and if they're taking the medications properly, and how their lives are going on the daily basis. And also we get to meet with the family and know and see if there's any problems and if there's any way we can help the family at home.
When you have told that you are HIV/AIDS, sometimes the mother lost control, say that nothing maybe can be done. But for Mothers Club, when they come together, they form the group, they support each other, and the no stigma, and they plan their future together. So Mothers Club is very, very important to our setting. And also the nurses, they have opportunity to share ideas, and the nurses and the doctors are giving the good adherence counseling, and they can get the hope again, and to bring other family for checkup, and also to continue with the ARV. And the most important is to adhere the ARVs, so when they saw that, they can transform the information from here to other patient or to another mothers who are all ready to come for checkup or who are all ready to come for club. And they are so pleased because now the children are born HIV negative.
Kids Club is where different children come, they receive their medication, get some really good education about what food is good for them to eat. And we've just been here really just playing and having a good time and socialising with everyone.
As a social worker, I found it remarkable the work that's done here in the most challenging circumstances sometimes, in small rural villages, in the hospice itself. But the work that's done here with children who are born HIV positive, who will bear that burden for their lives, is incredible. The emotional help, the physical help, the education given to their parents is so important. It's a chance for the children to be in a safe place, to talk, to be with other children who are also HIV positive.
The support and leadership given by hospice staff to children at Kids Club since 2002 has been life-changing for many in Muheza.
When I was young, hospice helped me, especially school issues. That time I was living with my grandparents, so it was so difficult in our family. So hospice helped me to see my dream. So now I'm a teacher. Also I love singing, so I have joined with the choir. So I'm a member choir in a church. So I'm enjoying when I'm teaching, because these are things which I like from my heart.
One of the focuses of palliative care in the UK is the idea that everyone has a right to a good death, and it's really lovely to see the support that people here are given, but it's so important to see the trust that people have in the centre and how much that builds trust in other medical services. It affects everyone, it's a close-knit community.
Mimi kwa jina ni Roda Kijangwa. Niko na tatizo la kansa. Mimi ni mjane, nimebahatika kupata watoto 4 na wote wamefariki. Lakini ninashukuru kwa msaada ninaopata hapa. Kama nilivyotangulia kwamba ninapata tiba bure, kama najisikia maumivu ninatibiwa bure, ninakuja kuchukuliwa kitoka nyumbani kwa usafiri, na pia huduma za kiroho ninapata kwa ajili napata faraja kwanza ninapokutana na wenzangu kama hivi, kwa kuwa tatizo hili si langu peke yangu, niko pamoja na wenzangu. Kwa hiyo tukikutana mahali kama hapa, kwamba kama tunabadilishana mawazo, nashukuru kwa hilo.
Everything you've seen in this film continues to be made possible by your generous contributions, and it means such a lot to the people in Muheza. And I just want to say an enormous heartfelt thank you.